that is our goal, is to get into those communities, especially as we move into phase 1B, which will have a lot of our essential frontline workers and will expand to more of the general population.
My next question is on contact tracing. Is the state still doing contact tracing? How long does it typically take to reach people who've tested positive or the people who've come into contact with someone who's tested positive? And how are things going on the contact tracing front?
Yeah, so we have continued to do contact tracing. The state, we've got about 600 people that do contact tracing. We diverted several of those, though, to help us with our call center. But our goal is to reach people within 48 hours of their results as they're reported, so that we can follow up, identify, where they may have been, who they may have been exposed, so that we can follow up with those contacts.
Last question for you is about racial data in vaccinations. As you mentioned, there's a high percentage of unknown racial data. Why is this? And who are these people that are not, I guess, providing their racial data? Do we think that there's actually a higher rate of minority communities that are being vaccinated than we're seeing reported? Yeah, that's my question for you.
Yeah, so when you look at the state pods, if you're using the VMS, it's a required field. And so these are people who are going on, registering it and filling it out. There's an other or unknown category. So other can be people who identify with multiple races or multiple ethnicities. And so that's a little bit harder to tease out. What I will say is historically, race and ethnicity has been something that's very difficult. We don't get that data completely. However, I will say it shows promise, because our race and ethnicity data for our vaccination is actually much better than it is for our cases and hospitalization. But we do need to leave that unknown or other in case people don't want to give up personal information or are uncomfortable sharing with that. But we have encouraged to our call center, to our people who are at our state vaccination sites, this is a very important piece of data. So please make sure that you are asking for it. If someone declines, don't push them, but we do need that information so that we can identify what communities we still need to target outreach to.
Excellent. Thank you.
Welcome.
Next is Stephanie Innes.
Hi, Stephanie.
Hi, Dr. Christ. Thanks for taking my question. I just wanted to ask about the dashboard. So moving forward, this 1.1 million of doses administered, is that a good number for us to use? Does that include IHS and the VA? Is that a completely comprehensive number now of people who have been vaccinated in the state?
So it is not a completely comprehensive list. It's our federal partners are pretty good about reporting to us. They are not required to, though. However, we do have some data sharing agreements with some tribes. They will input things into ACES, but they are not required. So it's not 100% of our tribal entities or the VA. I would need to check in to see if the VA is reporting. Historically, ACES it was started as a pediatric or a child immunization registry. Adults are not required to be input into it. This is the first time that we've required that. And so let me check to see if the VA got online with that or not.
But the retail pharmacies, as you said, will be included in that.
Yes, so the retail pharmacies are included in that, as well as the CDC Long-Term Care Partnership Program.
Oh, great.
So they are required.
So it's a pretty good number. It's just missing a couple. It could be missing a couple of things, right?
Yeah, it could just be missing a couple of things. And we do have some IHS facilities that do reports, but it's just not 100%, but we're getting the majority.
Great. Well, thank you so much.
Next is Nicole Ludden. I hope I pronounced that right.
Yep, Nicole.
Correct. Hi, can you hear me okay?
Yeah.
Awesome. So my understanding is that vaccines are allocated on a pro rata basis of the population of that the phase of each county is in. And I think you touched on this a little bit in the chart you showed in your opening comments, but could you explain exactly how the state determines how many people are eligible in the phases each county is in? Do you look to the counties to provide that information, and how is that done?
Yeah, absolutely. So what we do is when we get the allocation, we take a look at what phases the counties are in. Right now, most of our counties are in some phase of 1B. We have population estimates from the U.S. Census Bureau as well as the Department of Labor. So we know that our estimates for the populations in each of the prioritized areas, they're not mutually exclusive. So if I was over the age of 65 and I had a medical condition and I was still working as a teacher, I might be counted in all three of those groups. But we list what our population, if you go onto our website on our vaccine information page, you can see what our population estimates from the statewide basis are. And then we have that broken down by county. We then use that formula for the percentage. So right now we're using the 1B. And we take a look at the number of Pfizer doses and the number of Moderna doses. We identify how many of the second doses we have, and we use those second doses to fill in for the counties that got them for Pfizer 3 weeks prior and for Moderna 4 weeks prior. So those get loaded in. Then we take the first doses and we use the population calculation to determine the number of doses that should be allocated to each county. For those counties that have the pods, what we do is we take out the number of doses that we need for those state pods, put that to the side, and then take the other doses and allocate that to the county for them to do. Now, with the executive order that Governor Ducey issued, it's the 2021-01, that does require that counties that have more than 40% of their doses remaining to either work with the department to develop a plan or they don't get additional vaccine. And that same thing goes with providers. So there may be some adjustments that need to be done if somebody doesn't fall into that criteria. And then we will work if there's special programs. Like if a county's like, I don't need this vaccine this week, then we may identify a county that's doing a big pod and say, well, this county's not using these doses. We're going to transfer over 1,500 doses to this county because they want to do a mass vaccination pod this weekend. And so then we'll shift around based on those special priorities, send it out to the counties, and then the counties let us know where they want those doses to go. There's also that confusing issue about like the minimum number of doses. So for Pfizer, we have to either round up or round down to that 975. Or we have to, for Moderna, it's easier because it's minimum doses of 100. What's really going to cause some consternation this week is that they have decided that you can routinely get that 6th dose out of Pfizer. So I'm just going to caution everybody right now on the 15th. Oh, apparently Siri's talking to me. On the 15th, they will include that 6th dose. So instead of allocating the 975, of which we've still been getting that 6th dose, they will be allocating the 1170 that you will get in each tray. And so that's going to look like we got a significant bump in doses, but it's actually level setting, just making us technically able to record that 6th dose. So next week, it may look like we get a huge increase in Pfizer, but it's going to be level. But then the counties then will tell us where they want, and we place those orders, and then it goes to the recipients of it.
Gotcha. Thank you so much for that clarification. And then since the state is vaccinating 65 plus while Pima is still in 70 plus, will that allocation go to Pima County? Will that allocation go into Pima County, will that increase to include those above 65? And if so, would that increased allocation only be supplied to that state-run U of A pod?
So as we're doing the 65, we're already including that in everybody's population estimate. So even if they're not doing that, we are including it just to make it simple. But so it won't increase it now. But what we're hoping is as we get more vaccine, it will increase the allocation to the areas that have those state pods.
Thank you so much.
Welcome.
Nicole Grigg.
Hi, Nicole. I don't hear you.
Hi, Dr. Christ. It's
there
been
you are.
a while.
Yeah.
Oh. Can you hear me?
Now
It's been a while. We just want. Okay, you can hear me now. Good. I wanted to switch gears though, as we are now approaching 15,000 deaths, and I just really am curious. Why do you still stand by your decisions that you've made over the summer? You did the report in the CDC about how successful Arizona was in the summer with all the mitigation measures that worked, but you didn't do them in the winter surge. So the fact that we have the week of January 10th, we had 993 deaths in 1 week. Could you have tried to do more to prevent those deaths?
So the reason we didn't implement mitigation strategies was our mitigation strategies were still in place for the summer. And so we knew that if we implemented new mitigation strategies, they weren't going to impact where people were being exposed, which is in homes and in those private settings during intimate gatherings. We continue to monitor the data, and even just one death is horrific. We are going down in all of our other metrics and continue to monitor. We know that the death data lags behind, and so we will probably continue to see deaths for a while.
In the triple digits then. And my second question, we have not seen the governor take part in a COVID briefing since before Christmas. Do you know why? And I'm also curious if you have actually spoken to any families in Arizona directly who have died from COVID-19.
So I know that the governor's been doing some interviews. Because we get so technical with formulas and stuff here, it doesn't really make a lot of sense for him to join us here. I don't know when the next briefing will be. And yes, I have talked. I mean, I've been out, I've been vaccinating people, I've been talking with families. And so, yes, I've been touched by a lot of the different stories that I have heard.
Okay, thank you. And that's why, with 15,000 deaths now, I just didn't, do you feel that there was anything more you could have done in Arizona? Thank you.
Yeah, thanks, Nicole.
Nicholas Gerbis.
Good morning,
Nicholas?
good afternoon, Dr. Christ.
Hi.
I was having a little trouble unmuting there. So just a couple quick questions. First, when the Tucson pod opens next week, do you have a sense of how many appointments that'll have available?
We are working on that right now to see, because it's going to be phased in. So they already have some appointments scheduled, and we're working with them on transitioning to the state registration system and how that will build out. So we should have more answers to that over the weekend.
Okay, will you be putting out some information on that then over the weekend or Monday? Okay.
Yeah. So as we get closer, we'll be putting out information, and the appointments will open Tuesday morning at 9.
Thank you. So my other question is, I've and my colleagues have been hearing quite a few reports of ineligible or confused people being able to book appointments on the state appointment site and then getting turned away when they show up to get their vaccinations. Why isn't the website screening out these ineligible people, and why is it misclassifying them or sending them to the wrong places? And is there something that's being planned to deal with that?
Yeah, so we are continuously making updates to our website and working with our partners, Google and MTX, who built the website. A number of enhancements went in place, like to help people find new appointments so that you don't have to search day by day. That was my frustration when I had to use it. As well as not having to re-enter. So we are working on that. It sounds like there's a couple of different issues that may have impacted some of those. One was that the screening tool for a certain number of appointments wasn't activated. That now has been reactivated, so that should go away. The other thing is, given the such high demand and the limited number of appointments we have, and my team is on this to fix this for Tuesday, but people would get a whirling circle. And so you would wait for you would hit confirm, you'd get this circle, it would just keep circling. What people started doing was taking screenshots of that appointment that wasn't actually confirmed in the system. What we were trying to do was to try, if they thought that they had an appointment and they were over 75 or they met one of the criteria, We were trying to accommodate those appointments, especially at the beginning before we could get the messaging out. But we continue to work with our website developers to continuously improve that as we open up new appointments.
Okay, thank you.
Thank you.
Jorge,
Oh, hi, Jorge. I don't hear you.
I asked him to unmute.
Oh,
Let's give him a second here. There we go.
Can you hear me now?
yeah.
Hi, thanks for taking my question, Dr. Chris. This is Jorge Valenzuela from Univision, Arizona. So
How
I have
are you?
great, and you?
Doing good.
Awesome. Well, we have a single question. We know that the vaccine tourism modality began here in Arizona. This means that people are bringing their relatives from Mexico or Central America to obtain the vaccine here. The question is, how does Arizona control that vaccines are administered to Arizona's residents and not people coming from other countries, like in this case?
Yeah. So we do not encourage vaccine tourism. We haven't seen a huge number of like tourists from inside the United States. What we would do, though, is encourage, you have to have an appointment at most sites in order to get vaccinated, or you have to be scheduled through an employer-based site right now, since we are in phases. We have asked, we've given the retail pharmacy partnership program specific criteria that they have to screen for. One of the things, though, that we would caution is we are not requiring residency in order to get vaccinated here in Arizona. And that's because, our infectious diseases, they don't know borders, they don't know residency. And what we want to make sure is that Arizonans are protected. And so if we've got winter visitors, if we've got migrant agricultural workers, if we have people, during the winter, we get a large influx of people who are experiencing homelessness. We want to make sure that they are protected, and that if we can avoid having people utilize hospital resources by vaccine, that's what we want to do. So we want to make sure that anybody who comes into contact with Arizonans or our community is protected, because they still can spread and become infected with COVID.
Thank you so much for your answer. Have a happy Valentine's weekend.
Oh, thank you. You too. It's my 10-year-old's birthday is Valentine's Day. I told him he's the best Valentine's Day gift I ever got.
Oh.
So we're excited.
Next is Patty in Tucson.
Hi, Patty.
Hi, Dr. Christ. Can you hear me?
I can. How are you today?
I'm fine, thanks. Thank you for taking our questions. So my understanding right now is that Pima County will receive less vaccine next week, 16,330 doses compared to the 17,850 we received this week. And as a result, we are going to need to severely cut the number of first doses that we're going to be doing. And I wondered if you could please comment on that from a public health perspective, what that means to now be reducing the number of first doses we're giving out.
Yeah, so they will actually be getting more doses. The number of doses that we allocated, that 16,000 number, that's what Pima County will be able to allocate. They will still get the 5,800 doses of Pfizer, but what we're identifying is that because our Pfizer is so limited, we need to work directly with the pods to identify the number of appointments that they have, so that we can make sure we're meeting those needs and allocating those directly from the state. So there's another, I think it's 5,850 that they will be getting. In addition, we have held back 3,000 Moderna doses, or I think it's 2,000 Moderna doses that also will be going to Pima County, but Pima County no longer needs to allocate to the state pod. We'll be doing that. So we're working with all of the partners on that, but they are actually getting more vaccine this week.
Okay, so just to make sure that I understand you correctly, will the Pfizer doses then be going to the new, no, okay.
No, so we'll be working with TMC, the U of A, and I think there's one other site that gets Pfizer to make sure that they've got the vaccine allocated that they need for their appointments.
Okay, so out of this, the allotment that we're getting this week, will the state site at the U of A be utilizing those doses, or will there be a separate amount that will go to the U of A site?
So the 2,000, we're working with them on that right now. We've set aside 2,000 for the U of A. and working with them on how much they currently have and what else they need.
Okay, so we've got 16,330 and then another 5,800 of Pfizer, and then another 2,000 going to the state site?
Yes, yeah.
Okay, so those are all separate amounts.
Yes, so those are all separate amounts. But when you look at what we are putting into the allocation tool for Pima County to decide where it's going, that's the 16, I think it's like 16.3.
Yeah, that's right. Yeah. Okay. And so will everyone who got a first dose of Pfizer be able to get a second dose of Pfizer? And if they can't, is that a concern?
Yeah, so right now we do have second doses to match first doses, and we are covering all of those appointments, and then we will be reaching out. We don't know how the Tucson pods are doing the ones that are under the county are doing their second appointments, but our intent is to make sure that everyone who gets a first appointment also has a second appointment.
Okay. And it is, but are you saying that it isn't your understanding that we will need to cut first doses? Because I'm hearing from our health department here that we will.
I'd have to see what their plan was. They may not have realized that we're also still going to be allocating those doses of Pfizer, as well as allocating Moderna to U of A. So we're working with them on that, but I don't know how many first doses they had planned.
Okay. All right. Thank you.
Yeah, absolutely.
Okay. Next is Carla Navarrete. I think you're unmuted.
Hi, Carla.
Hi, how are you, Dr. Christ?
I'm good. How are you today?
Good, thank you. Thank you for taking my call. So I'm focusing in on the racial component of the vaccine rollout. And I spoke with Equality Health today. They tell me that they're working on creating these micropods. Can you comment on when those may become available? And are they going to be in communities of color, primarily Maryvale, South Phoenix? Are they going to be established in areas that people in the community are familiar with as far as COVID-19 testing sites in the past?
Yeah, so we have been working with Equality Health. What we asked them to do is to give us their plan for about 5 to 10 consistent stationary sites. Some of them may be where the COVID-19 testing sites were, some of them may be new. But what we've asked them to do is to target them all into like highly vulnerable communities of color so that we can reach out to those communities. And we'll be providing support through financial, through staffing. We anticipate that will start hopefully in March. And that was one of the providers that we talked about, that could potentially be a great partnership to use the Johnson & Johnson, the new one-dose vaccine that's coming out. But we're working with them, and that's exactly the intent.
Do you know if those would also be like maybe the State Farm, 24-hour running site, or is there not such a demand? Or I don't know. Is there a time frame that those would be running?
I think it will depend on what plan they give us. We're always happy to support 24/7, but sometimes for those smaller sites, it might not make sense. But the other thing that what? Sorry?
No, I didn't have a question. Sorry. It must have been my child in the background.
Oh, that's okay.
Sorry.
But the other thing that we're looking to do potentially, if people want to go to the 24/7, is looking at partnerships so that we can provide the transportation for them to get to the 24/7 site. Right now, it's just the one. We're hoping soon it will become all three. But understanding that people have different schedules and different hours, and we want to make sure that people have access to the vaccine.
And then the registration portal, is that going to be in Spanish starting on Monday? Is that correct?
Yes, that is what we are working on. So we are hoping we are going to be testing it this weekend, and then hopefully it goes live on Monday.
Okay. And then one last question, because I know there's others who have questions as well. One thing that the person from Equality Health mentioned is that he's seen a decline in COVID-19 testing these last couple of weeks. And so, he mentioned that this whole strategy needs to include people to continue to get tested because that gives them their health status. Have you seen the same type of trend? And maybe it's, we're done with the holidays, we're kind of getting back into the routine of work, but can you send a message out to the community about maybe the importance of continuing to test if you feel you've been exposed?
Yeah, absolutely. So we are seeing a decline in the number of tests being performed. It's still a very large number. But what we've identified during these surges is as we get more cases, the demand goes up, and then the demand tends to taper off. We would encourage people, especially if you've been out in large groups or attended a function where you didn't have a mask, to go get tested, because we do know that there is a high percentage of people who are asymptomatic who can transmit this. And what we're trying to do is to protect those vulnerable individuals from having COVID even come into contact with them. So it's always good to know what your status is, especially if you're going to be attending a function with loved ones.
Thank you so much. Have a great weekend.
Thank you. You too.
Next up is Bud Foster.
Hi, Bud.
Hello there. How are you?
I'm good. How are you today?
I'm doing very well. Thank you very much for taking my question. If you look at the vaccine data dashboard, it says in Pima County that they have ordered 189,725 doses. They have administered 180,607. That is 95%. And it says 95% utilized. Can you explain to me what that means when they say 95% utilized?
Yes. So as you look at the number of doses ordered, that gets updated every Monday. And so we take the total number of administered doses and divide it by the number of ordered. Now, the number of administered is going to include all of those doses that have been administered through vaccine that was allocated to them, but it will also include vaccine if they've got federal partners that are reporting, or if the long-term care pharmacy program goes into a long-term care or does a retail, they will report also. And so it's really just the percentage of the number of doses that have been reported as being administered to an individual divided by the number of doses that have been ordered by that jurisdiction.
Is 95% utilized worrisome because we have the second doses obviously coming up? Is 95%, does it show that they've been very efficient, or is this something that's worrisome?
No, so I think I would look at it from both ways. I think that it shows that they've been very efficient and we are using what we have on hand. Now, on Monday, that number will change again because the number ordered and allocated to them will increase. But worrisome because as a state, we are outpacing the vaccine that is being provided to us from our federal partners. So that's a concern. But Pima County is doing exactly what we're asking them to, which is to get doses into the arms of Arizonans. We don't want to be sitting on doses. So they're doing a great job.
Right. And it has nothing to do with second doses or anything of that sort, the utilization?
Right. So that is just total doses administered over total doses ordered. So that's first and second doses.
All right. Thank you very much. I really appreciate it.
Yeah, you're welcome.
Austin Walker.
Hi, Austin.
Hello. Hi, how are you doing today?
Good. How are you?
Very good. Thanks for taking my question. I just have two really quick ones. The first one is, I know we kind of touched on it beforehand, but I know President Biden did just release a statement that says all Americans can be vaccinated by July. Is that actually realistic? And if so, how many doses would we need here in the state to make that happen?
So it could be realistic. Keep in mind that's every American that wants to get vaccinated can get vaccinated. If we wanted to vaccinate all, 7.3 million Arizonans, right now we would need 2 doses for each of those. So it'd be about 14.6 million doses that we would need. However, we know that we're probably looking at 50 to hopefully, Howie, 70%. And so then that would be the 7.6 million that we might need if we were going for about a 50% vaccination rate by that time. It's going to depend though, because when the third vaccine comes out, that's a 1 dose. So that's a game changer because you only need 1 dose to get its full effectiveness. And so we'll continue to monitor and see what that looks like. And we are hearing that in March, the supply is going to pick up significantly. So hopefully that's doable.
Great, thank you. And then my next question is kind of a different point of it. It'd be about the categories. I know that many physical rehabilitation sites check a lot of the same boxes that nursing homes and as well as assisted living homes do as well. But many of those rehabilitation centers do not fall into that same category. So I'm wondering if who kind of decides if they do or not, why don't they? And if they do, correct me, but I just would like to clarify that possibly for those individuals that are in those centers without a vaccine in their arm.
Yeah. So with some of those rehab centers, they wouldn't be the congregate living centers. And so that would be and it depends on also what you're looking at. If you're looking at a rehab center for like physical therapy rehab, those individuals would likely qualify under one of the other priorities. If you are looking at a rehab like alcohol or drug treatment rehab where people can live in those facilities 24/7, they are actually prioritized, I believe, in 1B if they have high risk medical needs, which we are not to 1B just yet. But it also can be 1C. So that's when everybody who's living in a congregate setting that's not a long-term care facility will be able to get vaccinated.
Great. Thank you so much. I appreciate it.
Yeah, you're welcome.
We have Dylan Rosenblatt.
Hi, Dylan.
Hi, Dr. Christ. So a couple of quick questions for you. One, you mentioned on the top of this whole thing that you're aiming to add a couple of extra information topics to the vaccine dashboard. You mentioned zip codes as one of them. Curious what else you're planning on adding that we can expect to see.
Yeah, so the other things that we are looking at are adding the percent utilization by jurisdiction as well as the rate vaccinated. So those were in our infographics, but weren't. They had to pull data sources from other sources to get those in. So they're still working on incorporating those two values into the dashboard.
Okay, and then why wasn't zip codes included on the original launch of this dashboard this week? I know that's something that people have been questioning leading up to when the vaccine dashboard was going to happen, but it launched without the zip codes. Maricopa County just launched theirs with zip codes. I'm curious why yours didn't have one.
Yeah, we were trying to get out the vaccine administered data as quickly as we could. The data comes from a very, very clunky database that we were having some issues with not updating in the mornings. And so we wanted to make sure that we had that solid. We will be adding the zip code. It's a resource issue. And so as we get those maps built out and added to the dashboard, we will be doing that.
Do you have an ETA on when we can expect to see that?
Oh, goodness, I wish I did. I'll have Steve follow up. Let me ask the team on that because they are actively working on it. But I think some of the team that is actively working on it is also our vaccine management deployment system. So like today they're down in Tucson deploying the vaccine management system like with the U of A. So let me ask them the time for that for you.
Okay, and last question. I haven't seen anything on specific numbers about vaccines in the prisons, and I'm curious, have prisoners started to receive their COVID vaccinations yet? And has staff, and I know some staff and corrections officers were some of the first ones to receive it early on, but I'm just curious on what those numbers breakdown were.
I know that they've been working on the staff because we've been actively engaged with ADOA on vaccinating the prioritized 1B staff statewide. So I know that there have been several prisons that they have already offered staff vaccinations. You'd probably have to check with the Department of Corrections on their schedule for vaccinating of the prisoners. The only reason I say that is I don't know how many of them, because right now only those with high risk medical conditions would be prioritized in the 1B population, and then the rest of the general population would be prioritized in 1C because they're a congregate setting.
But to your knowledge, do you know if any of those high risk received their vaccines yet?
Oh goodness, I don't know.
Okay. All right. Thank you.
You're welcome. Okay, yeah, I can do one more.
Okay,
yeah.
This is Brian Webb.
Okay. Hi, Brian.
Hi, doctor. A couple quick ones. First, just making sure if someone has been sick with COVID-19, do they still need to be vaccinated? And secondly, what would you say to someone who is still reluctant to get the vaccine? Thank you.
So we are recommending that even if you have a history of COVID-19, you should still get vaccinated. The one caveat would be if you got COVID-19 and received the monoclonal antibody, so that bamlanivimab, or convalescent plasma during your treatment, we ask that you wait 90 days because you've already got the antibodies moving around and you won't mount as great of an immune response to the vaccine. But we encourage everybody, because we don't know how long those antibodies to natural infection are going to last. And we do know that people can get reinfected with COVID-19. My recommendation to anybody who is hesitant or considering this, we would recommend that you get vaccinated. So we know that it's going to provide a safe and effective way for your immune system to respond without you having to come down with COVID-19. COVID-19 is even more unpredictable than influenza. And influenza historically has been one of the scariest things I've seen. And we want to make sure that everybody's protected, because I've seen young, healthy people who have gotten very, very sick, requiring hospitalization, developing complications afterwards. And if we can avoid that and keep people out of the hospital and keep them healthy, that's better for their overall well-being.
Thank you.
Thank you.
Okay. Thank you, Dr. Christ. And thanks everyone for participating.
Thank you.